Every parent knows kids can end up in the emergency room with broken bones, scrapes, and bruises.
But more and more children are ending up in the ER with wounds that are much harder to treat. Tahlil Mohadeen introduces us to some people hoping to keep kids out of the hospital, filling a much-needed gap when it comes to mental health care. Tahlil?
Marymount Hospital leadership tells me dozens of families in our area are having to drive hours or find themselves on 6-month wait lists to get mental health care for their children. Some go without any help altogether, but the hospital hopes its new space begins to change that. Setting up a space that looks like a typical classroom.
We don't teach the things we need most a lot of times.
Kristen Johnson-Bott intends to change that here.
Coping skills and how to use our strengths and how to be, okay, who I am. And I guess if I can give them any piece of that, then everything I've done here would be so worth it.
Her classroom will be inside Marymount Behavioral Health in Middleton. It's a place where many adults have gotten treatment for months, but hospital CEO Saad Niazi says they've had to turn away about a dozen children per week, simply lacking the resources.
Everybody's doing the best they can. It's just that the need is grown at such an exponential pace, it's hard for anybody to keep up.
That often leads many children to a different space, the hospital ER. It's a place UW Health's Dr. Ali Hurst says can treat children facing suicidal and general psychiatric conditions, but knows it shouldn't be the go-to.
Suicidal thoughts are an emergency, but it is really difficult to be able to see those patients and prioritize kids that are having trouble breathing at the same time.
She says children facing these challenges is a known problem industry-wide. Staff at Marymount know they can't close the gap completely, but are hopeful the space starts to fill that void.
There's probably nothing more important than mental health.
The hospital would admit kids aged 12 to 17 for varying lengths of stay. Marymount leadership says most recommendations will come from families, law enforcement, or schools.